Hemato-Oncology and patient-allogenic bone marrow transplant for refractory acute myeloid leukemia of a 3-year-old male from Dushban, Tajikistan. Hearty welcome, sir. We also have the patients with us here. Let's have a huge round of applause as we would like to welcome on the stage Sobira with his father Zafarjan Bashir, all the way from Tajikistan. Let's have a huge round of applause, ladies and gentlemen. Thank you for joining us. And over to you, sir.
So, first of all, I'll take this opportunity to thank the Advantage, the creators of this. The theme for this conference, I believe, is the patient-centric approach. I believe the conference that is being organized in itself is sufficient enough to convey the message of patient-centric. Because all of us, I think since morning, have been talking about patient, how to improvise, how to get better services for them, and how to make them travel and sort of provide them the best of services. So, what I am going to do is start with the concept of Marengo. I think by now many of us would be knowing what is Marengo. Marengo is the name of the traditional Napoleon horse that was supposedly undefeated throughout his career. Because of the name of the Marengo that remained undefeated, our founder, CEO, Dr. Rajiv Singhal sir, had this vision for this hospital, the healthcare facility that will remain undefeated throughout, in whatever sense, in whatever good sense we can call it. This hospital is going to remain undefeated, and that is the reason this hospital is called as Marengo Asia Hospital. Why we are here to discuss patient-centric care. And what is the meaning of patient-centric care? What is the meaning? What do we imply by patient-centric care? In the next couple of minutes, all of us, all the hospitals that are present here, all the colleagues who are present there are going to convince each other that we are doing the optimal services in terms of providing a good patient-centric care for our patients. What is the meaning of patient-centric care? Collaboration and empathy, collaborating with the right partners and giving empathetic care to the patients. Customization of treatments so that the patients are at the core of delivery. Continuity of care from one department to the other. There should not be losing of the hands of the patients. Patients should always feel hand-held, and that is what is the meaning of continuity of care. Patient engagement. Patient should not feel, I have not been given the reports. Where are my reports? Where are my test results? How am I going to read about my disease? Handouts. Where are those things? Those things are a part and parcel of the responsibility of the treating team and the hospital. Proper access to care, and ultimately all of this results in the quality of care, quality of medical care that is delivered to these patients. Why is it important? Because it has been shown in the data, if these parameters for patient-centric care are followed, it results in improved health outcomes, enhanced patient satisfaction, efficient resource allocation, and ultimately resulting in enhanced clinician morale. So you and me will be happy only and only if you and me will be happy, because your patient will go happy, satisfied, not only medically but logistics-wise also. So these are some of the things that I think most of the hospitals are already doing in the sense to provide patient-centric care. Whatever local transport, accommodation, sightseeing tours, educational handouts by the departments, not only once but multiple rounds of detailed counseling sessions, personalized patient-doctor contact is something that many a times it is missing, and this has to be reinforced in a very positive and impactful manner. All the patients who are on current treatment should have a direct access to the treatment team, not through the coordinators, but direct access to the patients. And we are proud to say, Dr. Neeraj is here. Most of the times, if we open the phone of Dr. Neeraj, he will have a patient group to the tune of more than 250 patient groups, where the patients would be constantly connected to all the team members throughout their stay in the hospital or beyond that. We are regularly doing telemedicine connect. So virtual connects through video calling is a routine process that most of the team members are doing at some time or the other, maybe multiple times in a day, especially for those patients who require more hand holding than those who are less Financial counseling desk is 24/7 available, not only for the partners who bring the patient, but for the patients to clearly understand what is going on with their finances, whether the bill is more, less. Seldom it happens less, but yes, it can be a problem at times. Biosensor is a new concept that we are trying to incorporate. And what is biosensor? The patient who is getting discharged will have a sticker applied to his chest. With this sticker, the patient will go home, and the sticker will activate on the phones of all the clinicians that will sort of monitor all the vital signs, even if the patient has gone back home from the hospital. So that is what is the role of biosensors in clinical practice. Sooner or later, I am pretty sure most of the hospitals, like Marengo Asia Hospitals, will incorporate biosensors in the patients who are getting discharged after the treatments. What is important? This much we are doing, agreed. But beyond this, what? What is important is improvisation. How can we improvise the experiences? How do we get to the point where we say, okay, we have achieved something beyond this? There is from the recently concluded AI Impact Summit, AI has to play a role in clinical medicine, and there is no doubt about it. Sooner or later, it is going to come. The wish list for us at Marengo Asia Hospitals is some of these. Not only in daily practice, but in medicine also, how can artificial intelligence is going to play a role? That is what we are trying to understand and implement. AI chatbots is not a very distant thing. In a couple of months, probably, we are going to see AI chatbots that are available for the patients, whoever are getting discharged. That means 24/7 access. Right now, we are doing that manually, but sooner or later, automatic consultations and alarm raising at critical time points through AI chatbots is going to become reality. There is no doubt about it. Wearable devices, we just talked about, biosensors is a reality already at Marengo Asia Hospitals. Deep learning algorithms for ECG and CT scans. So this is something we are proud to say at Marengo Asia Hospitals. In certain hospitals, it's already available. What it means is, a patient becomes sick at 1 o'clock at the night, 2 o'clock the CT scan is done. After that, the doctor will see the CT scan fill maybe in the morning. But at that point of time, at 2 o'clock, how do we get the result? AI will come into picture and give a brief idea whether there is any grossly abnormal thing in that CT scan or a ECG, and what immediate action needs to be done. That action that cannot otherwise be waiting till next day morning. Apologies to say, but we are not those people who just say the things that are other people doing. We try to stick to what Marengo Asia is trying to establish in clinical medicine, and that is what is the motto at Marengo Asia Hospital. Sooner or later, India is going to become the medical destination for all medical treatments. We know oncology is on the top priority for medical tourists visiting India, but sooner or later it is going to become the destination for all the patients. So, coming to our dear friend, Mr. Subiro, this is the brief history of this patient. 20-year-old male, he is a resident of Dushanbe. He developed some complaints of bleeding and fever in October 25. He was diagnosed in the home country to have acute myeloid leukemia. He took next flight to India. Can you play this video? Can I request to play this video? That's a video. Okay, I'll come to this later. Just wait up. Just hold on. So, this is a brief summary of this patient. This patient had a bacterial pneumonia when he presented to our hospital. In patients with acute myeloid leukemia with pneumonia, you cannot take this patient for chemotherapy. He received immunotherapy, azacitidine, venetoclax, that's a standard treatment, for 2 cycles, to which he did not respond. Pneumonia responded, but AML did not respond. So, by the time his pneumonia responded, he was fit to be taken up for the chemotherapy. He received 1 cycle of flag chemotherapy. Unfortunately, his disease, that is AML, did not respond even after the strong flag chemotherapy. If you Google 2 patients with refractory AML survived, it shows very poor prognosis and it stops there. 3 months is the median survival if these patients are otherwise not treated properly in time. This is the medical literature that supports the same. Patients with refractory acute myeloid leukemia have a very less or poor survival to the tune of less than 20%. Only 20 people will survive long time. and the chances of them getting into remission with whatever treatment is less than 40%. So that's the medical literature that is available. So what we did was a sequential bone marrow transplant. And what is sequential bone marrow in conventional case? What we do? I am the patient, Mr. Bashir is the donor. I get admitted, take the chemotherapy, and on the day of transplant, that is day 0, collect the stem cell from him, and my transplant is done. In case of sequential bone marrow transplant, please ask your doctors, whosoever is doing bone marrow transplant, what is sequential bone marrow transplant? Sequential bone marrow transplant means the patient who is not in remission, despite whatever efforts, you give chemotherapy to this patient, give a break of 5 to 6 days, and take this patient for transplant in the same admission. What it means is the first chemotherapy that you are giving, the perspective and reason for that chemotherapy is to somehow get the disease controlled to whatever extent. And thereafter, when you proceed with the chemotherapy of the transplant, that transplant ultimately can lead to long-term cures. We have seen this before, and this is what we tried for this patient this time also. He underwent this sequential allogenic bone marrow transplant with his brother as a donor. Brother has gone back to his own country, and now he is 1.5 months post-transplant. And post 1 month, 1.5 months of his transplant, at present, his bone marrow is showing no disease. He is MRD, that is the highest possible measure of measuring a particular disease, is 0, the chimerism is full. So this is what we have achieved in this patient after a lot of things, and probably Vashibhai will tell sometime later that we had told this patient that the chances of survival for this patient is less than 30%. So we are happy so far. I'm not saying we have won the race, but sooner or later, we have some strategies in place already that we try to incorporate this patient for. So I try to rename, Dipaliji will be happy to see this. MAH stands for Marengo Asia Hospital, but I try to call it as most accessible hospital is Marengo Asia Hospital. It has got a structured patient flow algorithms and that are culture sensitive. Most importantly, different countries, different cultures, culture sensitivity. We do have failures clinically. We have lost patients in the past, but that did not deter us from doing good work, but that gave us lessons to be learned that should not be repeated in the future. But yes, we have many more clinical success stories. So that's the plan, growing stronger together. I'll just finish up in, that's the team. Okay. That's Dr. Neeraj who is sitting here. We do all type of treatments for different type of hematological diseases. Any hematological disease that is available, that is possible on this earth. These are the bone marrow transplant indications. So Raktaveer is our social program, and what it means is all people who are suffering from any type of blood disorders are Raktaveer. Raktaveer means blood warriors. So any person suffering from any type of blood disease is a Raktaveer to us, is a blood warrior to us. Some happy smiles, happy faces. Sometimes we are in good news. We help establish hospitals or bone marrow transplant centers across India also. Before I come to the end, I think I'll go to this. Can you just play this? So we just try to incorporate some AI version. I'll just come to this, and after that we are done. Okay, can you play this video, please? Can you play this video? 1 minute.
Hello everyone, my name is Vito. I am from Tajikistan. Welcome to India, Sobiro. We take care of you now. Yes, everything is ready. Thank you so much.
We'll help you recover completely.
That's the AI version.
Marengo Asia Hospitals.
Here's your medication. Take as directed.
Thank you. I'm doing much better. You've made remarkable progress. Your recovery is inspiring. The transplant went well. Your vitals are excellent.
We're here if you need anything at all.
Thank you so much. I feel good. The treatment is working. I feel so much better. Your results are excellent, Mr. Sobirov. We're very happy with your progress. Just make sure you're comfortable.
You're doing well. Continue follow-up. Thank you, doctor, for everything. Thank you, Dr. Meet, Dr. Neeraj, the whole team. Thank you, Marengo Asia Hospitals. I feel very happy now. Thank you so much for the care. I came with refractory AML, but here I found hope and expert care. Thank you. Safe journey, Sabiro. Stay healthy and keep in touch.
Thank you, doctor. I will.
Thank you, India. Goodbye. Goodbye. Thank you, India. Goodbye. Welcome aboard to Tajikistan.
That was the A version. Hope I think most of you would like it. That's what our expectation is. But before we end it, let's just request Mr. Bashir to share. Mr. Bashir is the voice of the patient at present. So I'll request Mr. Bashir to share what the patient wants to share at present of his experience of getting the treatment at Marengo Asia Hospitals, Gurugram. So over to Mr. Bashir.
Hi everyone. जब मिस्टर सुब्रो का वीडियो वेरी बंद कंडीशन मैं आएंगे डॉक्टर रविंद्र सर के पास ये सर बोलता कि 5% चाहिए tomorrow but now question Dr. Kumar alhamdulillah 100% okay. Thank you Dr. Amit sir, your team, Dr. Nidai sir, your PT team, thank you so much. My patient is okay now, alhamdulillah.
Alhamdulillah, so
Voice now, Master. Voice now.
sharp voice.
Now 100% okay now. Thank you sir for bringing.
Thank you, Dr. Veer. Can I please request you to join us on the stage for a group photograph along with our patient Sobira?